COVID and the COVID restrictions. We have here with us, my name is Þorsteinn Siglaugsson, and my colleague Jón Ívar Einarsson, professor at Harvard. We both belong to a group that's trying to promote more open discussion on COVID and the implications of all we're doing regarding that. And we have with us Dr. Alberto Giubilini, senior researcher at Oxford University, and Dr. Vilhjálm Árnason, professor of philosophy. Árnason, sorry, Vilhjálm Árnason, professor of philosophy at the University of Iceland. And we're going to discuss a few points regarding these ethical aspects. Before we embark on that discussion, which will be in English, I'm gonna have a short introduction in Icelandic, and then we'll move on. The meeting will be about an hour, and probably the last 10 minutes we'll use for a wrap-up in Icelandic for our Icelandic audience. Velkomin á þennan fund við Jón Ívar Einarsson sem að tilheyrum hópnum út úr kófinu sem að svona að reyna að opna umræðu og auka umræðu COVID og áhrifin af því sem við erum að gera gagnvart því, sóttvarnum og slíku. Við höfum fengið hér með okkur Alberto Giubilini sem við Oxfordháskóla heimspekingur og Vilhjálm Árnason, prófessor í heimspeki við Háskóla Íslands til þess að ræða nokkur atriði sem að snúa að þessu. Þannig að við erum bara velkomin að fundurinn verður á ensku en í lokin þá munum við svona taka stuttan snúning og fara yfir svona helstu atriðin sem hafa komið fram á íslensku fyrir okkar landa hér. So, what we want to discuss is primarily the ethical aspects of COVID, but I've asked our participants to reflect on a quotation from the Italian philosopher Giorgio Agamben, and this is it's basically comes from an article that Agamben wrote very early on in the pandemic, and where he's focusing on the effect of all those lockdowns and restrictions on our life as humans in society. And he's a bit pessimistic there, and perhaps at the time people didn't care very much about that, but I think for a lot of people they are seeing these implications perhaps more strongly now after 9 months of lockdowns. And it was interesting for me to read this short article by Agamben because I just finished reading a book by the French author Michel Houellebecq, which is called Possibility of an Island. And in that book, he actually describes a future society where people live in solitude, where everyone lives as individual. There are no human relations really. There's no physical proximity, no emotional relationship or anything. And to me, at least, it sounds like a world where you live a life that isn't really worth living. Now, to the quotation from Agamben's article. So I'll just read it out, and then I will ask Alberto and Vilhjálmur to respond. So it's this. The first thing that the wave of panic that has paralyzed the country obviously shows is that our society no longer believes in anything but bare life. It is obvious that Italians are disposed to sacrifice practically everything, the normal conditions of life, social relationships, work, even friendships, affections, and religious and political convictions, to the danger of getting sick. bare life and the danger of losing it is not something that unites people, but blinds and separates them. So perhaps if you would start, Alberto, by offering us your comments on this short passage.
Yes, thank you. I think there are two key ideas, key concepts in this quote that I think are very important. So the first one is about this word that Agamben uses, panic. And he uses this word often in the piece from which this is taken. He always talks about fear as well. Now, panic and fear have been the two guiding emotions that have driven pandemic response in many countries, well, most notably Italy, because Italy was the first country, it was Western country to be heavily hit by the pandemic, but most other countries. Now, panic is, so acting out of panic and fear is a justified and probably reasonable response when we don't know much about whatever enemy we are fighting. So at the beginning, we didn't know much about this virus, about the disease. Honestly, I thought, many people thought that disease was way more lethal and dangerous than it turned out to be. So we really responded with panic and fear, and that translated into the kind of measures that Agamben mentioned, like social distancing, lockdown, isolation. And that was fine as long as we didn't know much. At some point, we started knowing more about this virus. Now we know way more than we did in March. We know which groups are more vulnerable. We know which groups are relatively safe, I mean, young people. And yet, we are still responding with, mostly, that's my impression, with fear and panic instead of a rational assessment of the situation. Knowledge is the best weapon we have against fear, and I have the impression we are not using it because we are adopting the same measures we were adopting in March. The second thing is about the sacrifices that we are making. So Agamben mentioned, for the sake of protecting bare life, merely being alive, we are sacrificing many things that make our life meaningful: social connection, relationships, jobs, education. And that raises the ethical issue of what costs are worth paying, are ethically justified for the sake of protecting us, protecting people against this virus. Is it justifiable to lock down a whole society, a whole country, to protect a small portion of this country, or there are less restrictive measures that could benefit, well, that could be less harmful for the collective and for the individuals who are vulnerable at the same time? We need to get out of this state of fear and start thinking rationally about this if we want to implement the best policies possible. I think we will talk about this later.
Thank you. Vilhjálmur.
Yes. Well, I found Agamben's point here. I know he's speaking into the Italian context, but that shouldn't be the main thing. But I found it a bit cynical. I mean, that society believes in nothing but bare life and has blinded us to everything else. I think we could say, that quite the opposite. That the pandemic has made us see more clearly very important things in life, values that we have been neglecting, like solidarity and things that were sort of under a little bit under threat, like the importance of science and social institutions that we now see as crucial in acting in common, and even though some of the things that Alberto said, I mean, despite of them, I think this is a very cynical view on Agamben's part, that we are blinded to everything else than bare life, because I won't repeat that. We have been seeing our communal obligations. I don't think the Icelandic citizens or the Icelandic public have been paralyzed by fear or panic. I don't see it like that at all. And we have been addressed by the authorities as thinking citizens, and appeal to for taking responsibility not only for ourselves but for our fellow citizens, especially the vulnerable. So I think we could say, tell a very opposite narrative than Agamben does.
Mm-hmm. Jón Ívar, you have something to add?
Well, I think that the way that this has been presented, it was initially it was obviously overstated in terms of how severe this virus was, and I think that the fear and panic initially was perhaps justified. But as this has progressed, I do think that there's a certain voice of the government or the powers that be that is very prominent, obviously, and I think here in Iceland, the government has done a good job of giving us information. However, that information is very sort of unilateral, and they don't offer or allow, I feel like, sometimes open discussion. This is one of the reasons I think that we started this group. And I think partially I understand that. I think that they don't want there to be, they want society to be on board, which is of course very important. They want them to be compliant. But it sometimes feels that, we want to have a little bit more open discussion about these very severe consequences of what we're doing to stop the virus. Sometimes it feels like there's so much focus on stopping this one disease, and everything else is almost forgotten. And I know that the people who run things here, and probably everywhere else, they are of course aware that there are other things that are important. But when you have a new disease and fear, then I think people sometimes start to make irrational decisions. And I think that maybe has happened in some instances in this whole pandemic, potentially.
And this brings us actually, I think, to the next, into the proper ethical discussion, because of course Agamben's, he's a political philosopher mostly, and he's thinking about human relations. He's thinking about the concepts of bios and zoe, which is basically our life as just the biological life, and then our life as individuals in society. But this point actually brings us to the ethical discussion, and where we will start by discussing the lockdowns. And just before we go into the first question to Alberto here, let's just put it a little bit into context. So we've had now about 9 months of lockdowns, more or less. And when I'm talking about lockdowns, let's just clarify perhaps a bit at first what we're talking about. So lockdown, as I see it, is basically all these restrictions, closures of schools, of shops, of theaters, of cultural life, travel restrictions, and all of this is part of lockdowns. I think because sometimes people use the word lockdown for basically locking people up in their houses, but that's probably something you would rather describe as a curfew or even a house arrest. Curfew, when it's something similar to what maybe happens when you're at war, that people aren't allowed outside after certain hours in the evening or something. And if people are just, not expected to go outside at all, that's more like house arrest, actually. So lockdowns, when this all started, we had plans in place, some pandemic plans all over the world. And I think nowhere or almost nowhere were lockdowns a part of those plans. Then this all starts, and somehow, for some reason, the lockdowns really take place of the original plans that were in place. And why didn't people have those lockdowns in the pandemic plans? Probably because in normal times, when you don't have any, when you don't have the panic, when you don't have the fear, and when people are pulling together those plans, they think longer term and they think in a broader context. And so probably the reason those plans didn't include those measures where that people realized they would be very harmful, I would assume. But then somehow this happens, and it starts in March with the closure of. Well, first it's the closures in China, then it's Italy, and then it just somehow proliferates around the world and becomes sort of, what some people like to call the new normal, which I find rather abnormal, but that's another story. And for me, it was a bit of a wake-up call, actually, when the lockdown started in India. Because I've spent quite a bit of time in India. I know the Indian society quite well, and I work with people over there every day. And all of a sudden, people were just expected to stay in their homes. They were not allowed to go out in the street. And you have, in that country, you have hundreds of millions of people who just survive today on what they earned in the street yesterday. And suddenly, all of those people were driven out from the cities, and mostly by foot, because the trains were stopped, and those people don't have cars, and trying to reach their ancestral villages, and more often than not, they were even forbidden to enter the villages because of the fear of the virus. So that was a bit of a wake-up call that got me to think, well, this isn't. It's not just something that is of no consequence. It's something that is quite serious. How serious is it? We don't know precisely, but we can just imagine that it's going to be. So, Alberto, you wrote an article in the Spectator magazine a few weeks back that you call "The Absent Ethics of Lockdown." And there you argue that with the lockdowns, the solution has become part of the problem. And then you conclude by stating, lockdown will inflict more harm on society than perhaps any other measure in our peacetime history. This damage might or might not be ethically justified, but we will never know if we don't ask the question. Quote end. So by this, are you implying then that it is unethical to make decisions based only on the short-term interests? For example, by considering only the direct effect of the virus, ignoring the longer term or the indirect effects of, for example, extreme poverty, unemployment, our inability to properly finance healthcare, education and welfare, maybe in the short to medium term?
Yes, that's a good summary of what I wanted to say. Yes. Now, I think it's perfectly normal, like from a psychological point of view, for humans to address problems that are more visible, immediate, present. So you have a problem, you try to solve it. But if we want to think rationally and ethically about problems, we need to consider the broader picture. Now, when we think about public policies and public health policies, now it would be good to ask what exactly we want to achieve with all these policies. Now, a plausible aim of any public health policy is the preservation of people, of a population well-being, welfare, health. Now, all these things are certainly threatened by COVID-19, but are also threatened, and some of these things have been jeopardized by lockdown or any other kind of restrictions that you've mentioned. So I think it's a bit myopic view to just focus on lockdown, but not on the broader picture. I give you just a few numbers if you want. Like, for example, in the UK, almost 300,000 jobs have been lost since the pandemic started. More than 9 million people have been put on a furlough scheme, which is a big cost for the state, is a reduction of income for people. There have been increasing cases of reported mental health problems. All these problems strike the population in a very unequal way. So there's been a lot of discussion about how COVID unequally hit target different population groups, but lockdown and restrictive measures unequally hit different population groups as well. The disadvantage will be more disadvantage because of lockdown measures, not just because of COVID-19. So if the aim of our policies, as it should be, is to preserve the population's welfare, well-being, health, then we need to consider how these are threatened by lockdowns as well, especially since, given what we know now about this virus, and we didn't know in March, I have to say I was a big supporter of lockdown in March because I was afraid of this virus, as most people were. But given what we know now, there are measures that we could take, for example, shielding the most vulnerable, that could really address the problems raised by the virus by protecting the vulnerable, while preventing this great harm that restrictions are imposing on a population. So, for example, when I hear the news here, and when these numbers are given about job losses and mental health problems, these are always described as the consequences, the harm, the effect of the pandemic. Well, these are the effect of the measures we have decided to take to address the pandemic. Now, it's really hard to tell exactly to what extent these harms, say job losses, are caused by the virus itself, to what extent they are caused by restrictive measures, because it's not the case all the job losses, all the kinds of harms are caused exclusively by these measures. But it's plausible to assume that the vast majority of this, a great part of these harms have been caused by the measures we have decided to take, when there are alternatives available that could be implementable now.
So, Vilhjálmur, your reaction?
Yes, thank you for these important points. And I totally agree on the importance of asking the question and, and the need for ethical scrutiny. But, in my response, I want to perhaps point out the problems with it. And because, I think it's problematic or difficult how the idea can be properly assessed and weighed up against the alternatives without more knowledge than is available to us now. And actually, I think it's very unclear what it means to examine the alternatives. Because providing data about long-term effects of lockdown, for example, deaths and suicides, loss of jobs, as you mentioned, is tricky and can easily be manipulated because it's speculative. Of course, it's based on statistics given similar circumstances, but nevertheless, it can easily be. You have the recent Brexit discussion, and there were these discussions about the possible effects of leaving or staying, and all kinds of very it's very hard to sort of base good decisions upon these speculations. We are in a state of great uncertainty, and even though we have statistical probability for the long-term effects, we don't know what they will be. All kinds of unforeseeable developments can affect them. The speed with which vaccination has been produced was not foreseeable last spring, for example. Also, the harm of lockdown on society depends on many contextual factors. Which society are we talking about? Þorsteinn mentioned India. You are speaking basically from the British perspective. We are here in Iceland, and I think these three examples are very different. And so the alternatives that need to be examined. How has the state, for example, been used to mitigate the effects? We just heard on the news this today that prospects have been improving regarding Icelandic tourism, which is the industry that has been most affected by the pandemic here. And the spokesman of that industry is saying that it looks much better now than they thought last spring. So it's very difficult to sort of evaluate the alternatives. Also, I think there are, from a more ethical viewpoint, well, first, it's not correct that long-term effects have been ignored, as was implied in the question. Massive payments from the state have been made to alleviate the effects. Also, efforts have been made here in Iceland to have only partial lockdown. I know that Þorsteinn sort of described lockdown. It can be of various types, but it was very, very mild, relatively mild here. School, for example, have always been open for children, both elementary school and play school and at times high school. Now, the measures taken now also have sound ethical basis to protect the vulnerable, and that is the primary moral demand facing us now, even though it's not the only one, as you have stated. But the proposal to screen off the vulnerable and loosen other measures also faces serious practical difficulties and unintended consequences, possibly. First, it is difficult to sort out the most vulnerable. They are not only the elderly. People in older age groups or other age groups, have been badly affected and some have been in need of rehabilitation. Of course, the long-term effects are unknown now, but it is surprising how differently this disease affects individuals. A strict screening policy could risk unfair discrimination and require more actually authoritarian measures aiming at certain groups in society while ignoring others. I think this is something we would have to think about. And it could, and that's an unintended side effect, it could undermine important value that has been fostered by the current policy, which I mentioned before, the value of solidarity, which has been quite remarkable to see in practice. And the current policy has popular following. How do you deal with that in your argument? Now, also the current policy here, at least, it's been very clear, I think, in the mind of the Icelandic people that it has been argued for in light of the hope that they will be short-term. That is extremely important here, that people are willing to sort of go through this period seeing the light at the end of the tunnel, and now it seems to be coming sooner than people even dare to hope. Finally, an example that we have before us, the Swedish way, which avoided lockdown, has proved morally disastrous. Deaths per million are approximately 10 times higher in Sweden than in other Scandinavian countries. Now, possibly that could be justified if they were reducing the long-term effects, but that's not clear that they are doing that. For example, the GDP development is better in Norway than in Sweden. Norway has had much stricter lockdown, but they are on the rise in GDP. It's amazing, but Sweden is not. So there are all kinds of... I'll stop here.
Yeah, of course. But what, just to clarify the key question, when you say it's because the key question maybe is this: is it unethical not to take into account effects because we don't know precisely what they're going to be, or do we have to distinguish between something that we can support with data, even if we don't have the precise answer, and pure speculation?
If I say, I think it is wrong not to take possible long-term effects into account, regardless of how precise our knowledge is. We have, of course, the statistical information, and I have also always argued so myself that we need to take this into account, and I think the authorities have taken them into account.
Yeah,
the argument for the massive interventions of the state are of this kind.
Yeah, precisely. They try to counter the decisions, and But when we look at the world as a whole, we have statistics like the UN estimate that the number of people under the poverty line may increase by 50% due to this. And we know that last year 9 million people died of hunger. So from this we can infer something, and that's probably not something that we will ever counter with any countermeasures. You have some points regarding this?
Well, I think that just to paraphrase some of the things that have been said, on one hand, we're dealing with short-term, easily measurable things such as number of infections, hospitalizations, deaths from COVID. And these are highly publicized figures. They're, every day we're bombarded with these figures. But then on the other hand, we have the long-term effect of the measures against COVID, plus, of course, COVID itself. And as it has been stated, it's sometimes hard to distinguish which is causing these things. But certainly the measures are causing at least some of these. And those, child abuse, suicides, dropout in schools, lack of access to healthcare, those consequences are probably going to be drawn out for maybe a couple of years. So I don't think that we'll have a good idea of what was the right thing to do fully until at that time. But it seems right now that the sort of gamble to close things down and wait for a vaccine actually, paid off. It was a big gamble because I think that at some juncture, you're paying too big of a price to lock everything down to protect the public, because it's not sustainable. Like you cannot, if you think in extremes, you can easily do it for a month, but can you do that for 10 years? No, there's no way. But we were lucky in that we got, or appears to be at least now, a safe and effective vaccine in a record time that's never been done before. And so countries like Iceland and New Zealand that were able to contain the virus fairly effectively probably will come out sort of in a positive if you balance the pros and cons. But I don't think we know that yet, again, because some of those effects are unclear. And already in Iceland, we're seeing that potentially there's a higher number of child abuse. There's potentially higher number of domestic violence. We don't have the numbers for suicides yet, unfortunately, because it takes a while to accrue. But we'll have a better sense of those things, sometimes, maybe late next year or something like that.
And we have huge unemployment in Iceland, of course.
Of course.
That's definitely will cause deaths also, which we can base on research. Any concluding points on that, Alberto? Especially perhaps with regard to the alternative measures?
Yeah, so, this alternative measure is what the Swedish did. Now, I would be a bit more cautious in saying that was a moral disaster, because, people who have these views tend to compare Sweden with Norway, and Norway is doing better. Yet Sweden is doing much better than economically, for example, and in terms of death rates than other European countries. Well, it's true that one might say, Sweden is more similar in relevant respects to Norway than to other European countries. But I'm not too convinced about that. It's not just because geographically they're close to each other. That's the only comparison that matters. So Sweden is doing much better economically than the UK, than many European countries, has a lower death rates from COVID than these other countries. And in any case, even assuming that doesn't matter, which I don't think it does matter, but even assuming it doesn't matter, it's really too soon to say that there was a moral disaster, because we will see the consequences of these measures over the next years, not over the next weeks or months, over the next years. The UK is in the biggest recession on record. historically recessions are associated with higher mortalities and deterioration of public health. We will see that in the next year. So I'm not saying that Sweden got it right, the UK got it right. I'm saying that it's way too soon to say that it was a moral disaster, in my view.
Yeah, I shouldn't have used this strong word, that it was more disastrous. I mean, I agree, it's too soon, but there are flaws. I think there are serious moral flaws in that approach, and perhaps my wording is colored a bit by. I recently listened to a Swedish ethicist who was saying that people in nursing homes, they hadn't even been, the option of using intensive care was not even considered.
Yeah, so
I think that's debatable, actually, but we're not going there. Perhaps.
No, but I've heard this too, and that actually what failed in Sweden was actually the backbone of the strategy that they probably wanted to take, was to protect the vulnerable, but in the beginning they failed at actually protecting the vulnerable. And they both, it was because of lack of protective equipment and so on, but also, and this is something I don't know if it's correct, but I heard it on the Icelandic radio at least some weeks back, that they had in place an emergency plan that was supposed to kick in if the hospitals filled up. But for some reason, the emergency plan just kicked in right away, even when the hospitals weren't filled up. And the emergency plan basically meant that they just euthanized the old instead of taking them to hospitals. So that's actually the opposite, I think, of the strategy that Alberto is describing, which is basically about focusing on protecting the vulnerable. And maybe we see in Iceland also a part of the problem with when you don't have the correct focus, which happened here in the second or third wave, as some people call it, when we lost 15% of the old people in one hospital. Because the focus wasn't really on protecting them. They weren't in proper housing. All the measures weren't taken. So it's but like Jón Ívar said, we had a gamble, and we don't know yet if the gamble will pay off. We will know that later on. But now at least we have the vaccine, and now I think it's a very interesting discussion to have, especially since you're here, Alberto, because you've argued for compulsory vaccination, and I think it would be really interesting to if you would elaborate a bit on your arguments for that, because compulsory vaccination sounds like something really horrible to many people. Are you this horrible person who wants to send the police into people's homes and protect them?
I might very well be an horrible person, but not because of my view on compulsory vaccination. I think actually I would rather use the term mandatory vaccination. So if you say compulsory vaccination, people will think of someone comes into your house and sticks a needle into your arm. Yep. I don't think we should have that. So that's not what I'm arguing for. I'm arguing for mandatory vaccination in the sense there should be some penalty or limitations on the freedom of people who do not vaccinate. In the same way as we have had limitations on freedom of people now through lockdowns, for example, in order to protect other people. The difference is that vaccination is a much lower cost, easier, cheaper way of getting the same, actually better results. Because with a vaccine, you can create long-lasting immunity. Now, vaccination, I think, in general, but then there is some caveats for the COVID-19 vaccine. So in general, it should be mandatory basically for two reasons. First of all, because it's an easy way to prevent harm to others. If I'm vaccinated, I prevent harm to other people by reducing the risk that I'm going to infect these people. Now, it's a bit uncertain in the case of COVID. Well, if the vaccines that we have will also be effective or how effective will be at preventing transmission of the virus. They will certainly be very effective at preventing people from getting sick. But that's already a way of preventing harm because you reduce the burden on healthcare system, which is basically the main issue. That's the main reason why we're having all these measures. So the first issue is harm prevention. In the same way as the state mandates measures that prevent you from harming people in many other cases, then they should also prevent you from risking harming people through infectious diseases and through burdening the healthcare system. The second reason is a reason based on fairness. So the aim of vaccination policies is to create herd immunity. So that's the ultimate goal. So if you think of measles or the MMR vaccine, so what we want is to create herd immunity. Herd immunity is a very important public good. Everyone benefits from herd immunity. And as is the case with all very important public goods, there is a moral obligation on people to make their fair contribution to the public good because we all benefit from it. But normally, there is also a legal obligation to contribute to public good. So the analogy that often uses with taxation. So taxes are mandatory because the public goods you can promote and preserve through taxation are very important. And there is also an instrumental value of fairness in this sense because, so this is what philosophers so often call the problem of assurance. So the idea is that people are more inclined, more motivated to make their fair contribution to public goods, for example, to taxation, if they know that other people around them, if they have enough reassurance that other people around them do the same. Now, this role is fulfilled by some level of state coercion. If I know that there is a law that, or there are some restrictions whereby people are very incentivized to make their contribution, then I will be more inclined to make my contribution as well. And in this way, you get more people to collaborate to the common good, and you make it more likely to achieve whatever public good you want to achieve. So that's true for all vaccinations. So there is a reason of harm prevention and a reason of fairness. It will be true for the COVID-19 vaccine as well, except that we will have very limited availability at the beginning. So this argument, I would say, would apply to, for example, now we have vaccines in the UK. They've been approved only for the very vulnerable people, so the elderly. Now, if we want to target this group, which we can debate whether it is an appropriate measure, actually, but assuming that it's appropriate, if we want to target this group, then the same argument applies to this group. So it's a very low-cost option. It's a very easy, cheap way, compared to the restriction we just had, for example, to achieve whatever good we want to achieve. So that's roughly my main argument for mandatory vaccination. Not compulsory because I prefer mandatory.
Yeah, it sounds better. Vilhjálmur,
thank you. Actually, I read or browsed an article. I didn't have the time to read it all, where you sort of distinguished your own position from the one made by Navin and Largent on mandatory vaccination, and I took you to be arguing for a compulsory vaccination, or at least a stronger argument than Navin and Largent made. And I found myself in agreement with them more than with a stronger version. So I agree with almost everything you said, except sort of because I can see both clearly. The argument from harm prevention is a classical liberal argument and of restriction on liberty, and the fairness, of course. That is a stronger. Much stronger point to make, that you impose people, especially if you make it mandatory in the stronger sense than conditional on access to certain goods and services. I think in that sense I can well see the rightness of having mandatory vaccination. But if you take a stronger point of using the fairness argument, then it's not just conditioned on any specific social goods or services, but rather sort of the reciprocity in society in general, that you're benefiting from being a citizen. And then it's very close to being compulsory if you take it sort of without specifying the kinds of services and goods on which it is sort of contingent. But there's not much of a difference here, except perhaps you mentioned in your article sort of the backfire problem. And I think here in Iceland we have not made vaccination mandatory or compulsory because authorities have argued we have very good compliance with this, and it's sort of a default practice. And it's a very interesting aspect of that in sort of in light of bioethical argument generally, that there is no effort really is made to make people make an informed choice. Because actually, if you make people make an informed choice, they become, I think research has shown, they become less likely to be vaccinated because they start going on the net and they find all kinds of rubbish about vaccination. So it's better to just have a default sort of norm, have it as the norm. And then they say, well, if you start making it mandatory, then you have less compliance. So it's sort of a practical argument that we do well enough with the way in which we do this, and we reach herd immunity. And actually, I mean, going into strong mandatory policies it's very hard to make compatible with a liberal society. I mean, you it's very invasive and you are sort of violating bodily integrity, and so it's people have, even in the states where vaccination is generally mandatory, that people can have conscientious refusal. So, but I think we agree mostly on here.
Yeah. It's interesting that you mentioned bodily integrity, because it's maybe more a question of feelings than reason. When we pay our taxes, and some people might see that as an assault on their liberty to have to pay taxes, and I find it really difficult to see actually the difference between being required to get vaccinated, as long as it's safe and all that, of course, and the requirement to pay taxes, as long as it's based on the fairness principle, But what I feel also is that, and it would be interesting to have your response on that maybe, is that I find it actually more abhorrent to, let's say, like there is some discussion on that, excluding people from some of the basic, we'd call basic human rights, like the right to travel, the right to use some services and something like that. I find that a little bit more repulsive actually than being required to get vaccinated. I don't know why, but it's and maybe that's also because it feels like the herd immunity, and if we need to get herd immunity, which maybe we don't need that for COVID, I don't know, then that's it's a public good that we're achieving, and if we don't take part in it, it's we're not being virtuous. So to punish us for that, I find a bit of a difference between forcing us to be vaccinated to achieve this public good, and punishing us for not being virtuous. That starts to sound a bit scary, because then we're saying that the human rights are actually depending on virtue. So if you're virtuous, you enjoy certain rights, and if you're not, you don't. And we've all probably heard and seen stories, for example, from China, where people are, the human rights just meted out based on people's behavior and compliance and what they say about the government and so on. It would be interesting to hear your.
I just want to, one thing on the vaccines is that this is obviously appears to be a safe and effective vaccine based on these early data, but these are new vaccines that have not been used in humans, the mRNA vaccines, and then so that makes me uncomfortable to make it mandatory, at least in the beginning, until we have a little bit more experience. And then the other thing is that obviously COVID doesn't affect people the same way. So it's not like measles that everybody that gets it is going to get very sick. The young folks usually don't get very sick, although long COVID is of course an issue. And so in these studies, for example, 16-year-old and younger and pregnant women were not included, so they're not going to be vaccinated. And that's a big chunk of the population. It's probably like 20% of the population right there. At least in Iceland, we're a fairly young country. And there's also a question to me for younger than 30-year-olds, because their risk of getting seriously sick with COVID is extremely low. The mortality rate is less than 1 in 10,000. Most of them go through it without much of a problem. And if you take that, that's 40% of the population right there, in Iceland at least. But I think that, of course, the vulnerable and the older should be vaccinated as soon as possible, as well as frontline workers. But it's actually interesting to me that, I work in a large hospital in the US, and I have to get a flu vaccine. I can opt out, but, it's like for religious reasons, like it's not easy to opt out. But the COVID vaccine, it's been decided that it's completely optional. You can, it's not, there's no, they don't make it mandatory at all, which I was actually surprised that they would, because I work at a hospital. I work with potentially, COVID patients. I'm not in the ICU or in the ER, but, I'm operating on patients every day. So, and I don't know exactly why, maybe because, again, it's a new vaccine, and maybe they're worried that about unforeseen consequences. But I'm a little hesitant to mandate it, at least initially, until we have a little bit more experience. It sounds a lot that maybe 50,000 people already had these vaccines. And it sounds like, okay, that sounds great, then maybe it's completely safe, but that's not really a big number. When you start vaccinating millions and millions of people, it is certainly possible that there would be some unforeseen consequences to that.
So you're saying maybe that we shouldn't have to worry so much about mandatory vaccination because herd immunity isn't needed for this, perhaps?
Well, herd immunity would be ideal. That would be a great goal. We don't know completely. This 60% that has been. It's not completely known that we need 60%. Maybe we need 50%. Maybe we need 70%. It's sort of an approximation. But I feel like if we have vaccinated, let's say everybody, or 90% of the people who are over age 40, let's say, then should society be fairly safe to resume normal activities? I would think so. Yeah. But it's of course, if you can get as many as possible, and I think that a better strategy is to have everybody, politicians, celebrities, whoever has any kind of a following, show and be an example, and get vaccinated and try to advocate for it. I think that would be my approach, at least initially.
I agree with that, and actually, I think taking strict measures, making mandatory or compulsory, would not address the main reasons for distrust in vaccinations. It might actually exacerbate the problem. I see there's a question there or comment, on the screen, and I think that sort of reflects the kind of criticism or people have, or suspicion, and they are not addressed by employing authoritative measures.
Right. Alberto, some final comments on this? Is herd immunity needed for COVID? What do you think?
Well, needed is needed to get rid of COVID for good, but it's a very unrealistic aim in the short term. So I think the main thing now is to try to protect the most vulnerable, either by direct vaccination or through immunizing people around them. So there are different views about how this could be best achieved, but I think we should try to make the most of the limited availability we will have for many months. I tend to disagree with many things that have been said, because I think mandatory vaccination is still justified for certain groups, especially for the vulnerable, because even if the vaccine has some risks, it's very likely that the more vulnerable you are, the more worth taking it is. So if you are over 85, your risk of dying of COVID might be as high as 25%. It's very unlikely that the risk of the vaccine will be higher or worse than that. There might be an argument for vaccinating. So if you talk about vaccinating the very young or children, I agree, making it mandatory is more problematic. There is no evidence, no conclusive evidence that mandatory vaccination policies backfire. They can work well if properly implemented. They did work well in Italy when the MMR vaccine was made mandatory. Vaccination uptake went up dramatically, same in France. I don't think we should wait for the emergency situation to make it mandatory. Even if there are less restrictive measures, it's still risky. The UK had herd immunity against measles for a few years in children. Then at some point, vaccine uptake went down so there was no mandate. So I think it's an unnecessary risk we are taking, because mandatory policies, if properly implemented, they do work.
Yeah, right. So I think we've covered basically those two main subjects, but maybe something we would like to add. Jón Ívar, you have some additional points?
Well, I'll make it quick because we're kind of running out of time. It's been a really great discussion, actually, and I appreciate it a lot. But, it's sort of this question about, the ethics of a human life, really, are all lives equally meaningful or equally valuable? I come from, I'm an OBGYN, actually, but I also have a master's degree in public health. So in public health, we talk a lot about quality adjusted life years, and we try to calculate that out. And we've actually calculated the worth of a 1 year of quality life. That's been calculated out, even though that sounds kind of strange to many people. But, in this pandemic, we've been, in broad strokes, we've been maybe sacrificing the quality of life, education, et cetera, of the young people for the lives of the older people. That's obviously in broad strokes. But is that, justifiable? Can we justify that? And also, as I said earlier, are all lives equally valuable from an ethical point of view? It's a big question.
Wants to go first?
30 seconds to answer. I think Alberto, we have so little time for English left that Alberto should use that.
Yeah.
Well, the answer to the question, if all lives are equally valuable, is I cannot answer this question in 30 seconds. In an important sense,
I was joking. Not 30 seconds. You have.
In an important sense, they are not, because I can give you obvious examples in which, if I ask you, would you save a healthy 20-year-old who has a long life to live, or a 90-year-old who has a few days to live? Most people will save the 20-year-old, which means that life itself is not what we value. We value other things. Quality adjusted life years, for example, is one thing. Length of life, probability of survival. And I think these things should be taken into account also when it comes to vaccination policies and to pandemic policies more in general. So there is an obvious sense in which the answer, are all lives equally valuable, is no.
Right.
Well, yeah, well,
yes or no?
Well, no, not lives, but the persons are equally valuable, I think, people, humans. But when we are, as Alberto mentioned correctly, I mean, when we have to make tragic choices, we do need to distinguish between people, but not in terms of age necessarily. I mean,
no, I agree on that.
Frailty and sort of the usefulness of the measures, then it just makes no sense to not to distinguish. But it's a tragic choice, and we have to respect people equally, I think, regardless. But I mean, so yeah. I guess there's so much to say about this, but
no.
It's a very delicate issue. But it's always it's a situational choice that is, I think, important, and then it has to be very, very carefully argued for.
Right? Isn't it? Maybe it's a very, very difficult question. It's one of those typical ethical dilemmas that I remember learning about ages ago when I was studying philosophy. But doesn't it in a way maybe bring us back to Agamben's distinction between zoe and bios? You know, the life, bare life, and the life worth living. You know, that's I would think somehow that's maybe something to consider there. If you know, a life worth living is probably worth more than a life that isn't worth living, right? Would you say that?
The problem with this is that who is to evaluate the worthiness of that life, and I think studies have shown that the normal people, we tend to disvalue, for example, life of disabled much more than they do themselves.
Yeah. So it's very subjective, and probably Stephen Hawking is prime example of that. Was, you know.
Tom Shakespeare.
Yeah. But anyway, I think we're running out of time, and we maybe want to take a few minutes in Icelandic. So I want to thank you all for attending and for this really interesting discussion. I know that we are trying to cover a very big discussion that might take days or weeks in 1 hour, which is a challenge. But I think and I hope that our listeners have gained something from this discussion. So thank you very much, and I will now switch to Icelandic for a few minutes just to wrap up. Svo hérna, ef við kannski drögum saman aðeins, við fáum kannski, ef þú kannski myndir aðeins kommentera Jón Ívar á svona hérna, hvernig, hvað þú tekur út úr þessum, með þér út úr þessari umræðu við þessar menn?
Mér fannst þetta mjög góð umræða og hérna í rauninni ég var nú eiginlega vonast eftir að siðfræðingarnir eru svolítið meira ósammála en það alltaf skemmtilegra svona þegar fólk ósammála en það var nú því miður ekki.
Hann tók vægari afstöðu en ég átti von á í sambandi við bólusetningarna. Sko. Ég var búin að búa mig undir harðari eins og hann hafði miklu harðari. Sko. En ég held við séum ósammála hitt, sko. Miklu meira.
Já. Þetta náttúrulega eins og þú varst að benda á, þá þetta mjög misjafnt sko milli landa og mismunandi aðstæður, mismunandi líka bara gildi hjá löndum sem náttúrulega koma mikið inn í þetta, hvernig brugðust við og hvernig þjóðir vilja höndla þetta. Það svolítið svona, það líka mjög misjafnt sko og líka bara aldurssamsetning eins og Ítalar náttúrulega þeirra meðalaldur mjög hár og það nú eina ástæðan fyrir því að þeir lentu mjög illa í þessu en já, mér finnst þetta mjög áhugaverð umræða og hefði mátt alveg vera lengri en ég held að kannski fólk vill ekki hlusta á lengra en klukktíma í einu.
Nei, akkurat. Já, mér finnst þetta mjög gott og þetta svona sko, það sem að mér finnst kannski svolítið áhugaverð spurning núna er kannski þessi sko, hvað verður núna? Vegna þess að núna stöndum við frammi fyrir því að nú eru bólusetningarnir að byrja og ef við gefum okkur það gangi allt vel og það kom ekki eitthvað upp sko, sem alltaf dauðhræddur við náttúrulega við svona, eitthvað kemur upp og allt fyrir vaskinn sko, en ef við gefum okkur að það gerist ekki og við höfum þetta takmarkað magna bóluefni, þannig að við getum ekki bara bólusett alla og náð einhverju ónæmi í hvelli, þá spurningin svolítið þessi, nú erum við búin að vera með í 9 mánuði allar þessar aðgerðir og auðvitað náttúrulega jafnvel í samfélögum eins og Ísland þá náttúrulega valdaður tjóni og valdaður tjóni líka inn í framtíðina, við höfum erfiðara með að fjármagna heilbrigðiskerfi til dæmis í framtíðina, menntakerfi og slíkt af því við erum búin að setja okkur á hausinn. Og þá veltir maður fyrir þess að hvernig ætla menn höldum við áfram sömu stefnu sem sagt, það að segja að allt verði svona í hindrunum, alveg þangað til að búið að bólusetja hvern einasta mann og hundinn hans, sko. Eða munum við horfa á þetta þannig að þegar við erum búin að verja í rauninni þá sem eru í raunverulegi mestri hættu. Einhvers staðar sá ég daginn frá Bretlandi að það áætlað stjórnvöld með bólusetningum viðkvæmra hópa verði búið að útiloka 99% af mögulegum dauðsföllum, sko. Munum við þá sem sagt hætta, sko, eða munum við bara halda áfram og kannski hversu komum kannski aftur að, sko, óttanum sem að Alberto ræddi svolítið þarna í byrjun, sko. Hvernig snúum við okkur út úr í rauninni þeirri stöðu, sko, að við vitum að það er stóru hópar til þess að ungu fólki sem að, eins og Jón Ívar var að segja áðan, í raun og veru ekki neinni hættu þessu sjúkdómi, sem að samt eru algjörlega, sko, í panik yfir því að smitast, fólk sem á að þurfa að óttast neitt, sko.
Segjum lítilla hættu, ekki
lítilla hættu, já, mjög lítilla hættu, sko. Og hvernig vindum við í rauninni ofan af kannski, sko, þessum ótta við veiruna sem að hefur svolítið drifið áfram einmitt alla þessa samstöðu við aðgerðir og slíkt, sko. Þegar við erum komin þá allt í einu uppsjá, við þurfum ekkert lengur að óttast, við erum búin að klára þetta að því marki sem að þarf. Ég meina, hér á Íslandi erum við með, sko, 0,3% dánarhlutfall, held ég, eitthvað svoleiðis, 3 af hverjum 1000, og ef við erum búin að verja viðkvæmu hópana og ef það eru 99% sem við erum þá búin að útiloka, að þá erum við kannski með, sko, mögulega 3 dauðsföll á hverja 100.000 og það þá áfram þess virði að halda sem 20.000 fólks atvinnulausum, halda skólum á efri stigum hálf lokuðum eða alveg lokuðum og svo framvegis. Þetta er svona kannski það sem að velti fyrir sér svolítið um framtíðina. Kannski áhugavert að heyra frá þér, Vilhjálmur, svolítið hvernig þú hugsar þetta svona.
Á hvaða tímapunkt eftir þá að horfa svona eins og, meina þegar við erum búin að fara í gegnum,
sko, þú veist að eitthvað þannig, sko.
Já, sko, ég hef náttúrulega, sko, mér datt nú bara í hug þegar varst að tala að til dæmis að því að nú þá að halda staðpróf hér við háskólann, sko, en það er einhver umtalsverður fjöldi, ég man ekki alveg hver hann af stúdenta sem að mótmæla því, sko, að þurfa að mæta í
Já.
Þó að sé eigi að vera allt tryggt í aðstæðunum sem samrýmið sóttvarnum, þá er töluverður fjöldi mótmæla því að þurfa að mæta í staðpróf. Ég hef nú ekki trú á öðru, það er eitthvað við faraldra. Nú þekkir Jón Ívar þetta miklu betur en ég. Það er eitthvað sálrænt í samt við faraldra. Við vitum alveg að það er meiri hætt á að fara í bíl og sem sé. En það er ekki hægt að rökræða svona í burtu. Ég hef trú á því að svona, ég vona þetta sem kallaði new norm, ég er nú mjög óánægður með þetta nýja norm, ég skil ekki í því að vera kalla eitthvað afbrigðilegt ástand nýtt norm.
Nei, nákvæmlega.
Ég vona nú að það norm sem við munum sjá svona kannski mitt næsta ár sé að fólk bara finni það að það er orðið öruggt að umgangast í samfélaginu og ég held að þetta hljóti nú að koma með þessum sem sé, ég meina það er 92% Íslendinga lýsir sig reiðubúna til að fara í hérna. Og ég held að, sko, Íslandi held ég að vera, við erum auðvitað ekki bara að tala um Ísland, en þetta er auðvitað miklu alvarlegra í samfélögum eins og Bandaríkjunum, þar sem kannski bara innan við helmingur lýsir reiðubúna til að fara í bólusetningu og þar er auðvitað, sko, og þess vegna sagði ég áðan, við mætum ekki áhyggjuefnunum með auknu valdboði vegna þess að það er bara það sem mikið vantraust í grunninn á yfirvöldum. Og af góðum ástæðum, sögulega auðvitað.
Það er reyndar þetta í Bandaríkjunum, ég get með þess til, sko, að hluta til sé það vegna þess að það eru svo margir búin að fá COVID og ef þú ert búin að fá COVID að þá myndir við væntanlega bara að setja nei við, myndir við vilja fá bóluefni. Ég meina það er í New York sem staðar er bara 50-60% búin að fá COVID í einhverjum svona litlum sko afskeggum í New York City sko. En það voru mótefnamælingar þarna í New York í sumar sem sýndu það voru næstu í 30% sko sem hefðu voru með mótefni. Þannig að ef að fólk hefur fengið COVID þá náttúrulega myndi það sennilega tikka við nei hérna í skoðanakönninni. En auðvitað, en það hefur kannski eitthvað áhrif, en ég held samt af samstæðan þar sé nú ekki eins góð og hér, ég held það.
Ég held að bara hræðsla fólks kannski ekki endilega eigin veikindi heldur að það hrætt að smita þá sem að það kannski ömmu og afa og svoleiðis.
Þannig að það er náttúrulega hverfa þegar að búið að bólusetja þau, sko, já. Þannig að í rauninni þá eru kannski heimspekilegu skilabóð út úr þessum fundi á endanum það að við viljum ekki nýtt normal, we don't want the new normal, we want the normal back, right?
Akkurat.
Okay,
já,
so
það ekki bara ágætt loka orð.
I think those are the closing words from Vilhjálm that we don't want this new normal at all. So I want to thank you very much for this discussion, and it was really good. I hope it's been very it's been interesting, I think, for our listeners, and now we just all go back to the new normal while it lasts, and we hope the normal will come back. Thank you.
Ja.
Thank you.
Thank you.
Thank you.